so much fun. You get to touch my Tootsie. Hi, I'm Shari Martuscelli, BOYD in Ann Arbor. And today we have Betty Jane here, and she's going to be receiving a Geneveve treatment. Geneveve is a radiofrequency device that helps with vaginal rejuvenation, and it helps with laxity, helps with sensation, urinary incontinence, and dryness. And you don't necessarily have to have all of those to get the treatment. You can have just one of those symptoms. And tell me a little bit about today and what brought you here is the Geneveve treatment.
Absolutely. I came into BOYD and I saw a brochure on it, and I asked Dr. BOYD about it, and he started telling me and that you were doing it, and then I asked you as well. So decided to come back today and definitely do it. I've had 2 children. I won't say how long ago. So I would definitely like to rejuvenate that area, strengthen the walls. It just sounds intriguing, and I know that the results go on, you know, even after treatment, that it's not instant. It may take some months afterwards to build back up that collagen, but you've explained it fantastic in our consult, so it's been great.
So what it does is as we age, our collagen does break down in the skin and on the inside as well.
Yes.
So it builds up that collagen to help with one or all of those symptoms.
Perfect. I'm actually here today because I've had 2 children. My children are in their 20s, so empty nester. I am looking to rejuvenate that area. Not saying that there's anything wrong with that area, just saying that, you know, if there's the option that we can do something to strengthen that area as we age, it's really important to take care of yourself, whether it's, you know, external, internal, everything. So I believe in treating my body anywhere that I feel that there may be improvement. So I think that it's a great option for people that have had kids, people that, you know, may feel like they're losing their laxity in those areas, that come on in and do this. It's not going to hurt. It's going to be pain-free. It's 30 minutes of your time. You have a great provider that's going to treat you, and I'm really excited to have it done and see the results.
This is our Geneveve machine. It's a radio frequency device, and attached is the probe. It is very comfortable during the procedure, little downtime, may feel some cramping afterwards. It takes about a half hour, and with that, we are going to get started. Betty Jane, do you have any questions or concerns before we get started with the procedure?
I know you said it's about 30 minutes. I know that you said that the device was very small.
Yes.
That it's kind of like a vaginal ultrasound is how I related it, but obviously not as large.
It's a little bit more comfortable than a vaginal ultrasound.
So
you may not even feel the insertion of the probe at all.
okay. Yeah, no, I'm comfortable with all that. You told me it was going to be a little bit of a hot and cold sensation.
Hot and cold sensation, yes.
Okay.
If you had an episiotomy with your children, you may feel a little bit just around that scar, the episiotomy scar. It might feel a little more warmth in that area, but it's not something that's you're gonna want to stop that procedure at all. It's it's still very comfortable.
And what about like home care afterwards? Am I gonna have any issue? Or?
No issue at all. It's very comfortable. You may, like I said before, have a little cramping.
Okay.
But other than that, you just go about your daily business. We do tell you to refrain from using any kind of tampon or having any kind of sexual intercourse for at least 24, 48 hours.
Okay. So what about like lifting or anything like that?
Nope.
Or if I'm
you
going
can
to
go back into working out, right back to
Perfect.
it.
All right. Nope, that's it.
You're going to feel my touch.
Okay.
Joe? You're going to feel my touch again.
Okay.
Now you're going to feel a little insertion of the probe. Might feel cool. Are you comfortable?
It's fine.
Now I want to deliver the first pulse. How are you doing?
Perfect.
Good.
Let me know when I'm dilated and ready to push.
Now you're going to get 5 more pulses, just like that.
Is that like the prep or?
Nope, this is it. This is the procedure.
Oh,
This is
okay.
all you're going to feel.
That's it?
Yes.
Oh, guys, this is nothing. This is so nothing. You should get in here and do this. Really? Is that nothing? Now, do you increase the intensity?
Nope.
Okay.
This is all you're going to feel. Are you feeling warmth or cold?
I feel a little bit of sensation of the just warm, maybe a little, but nothing that's unbearable. I mean, it's very minute, very minor. And even when we talked about, you know, I've had kids and the episiotomy, I don't feel anything additional in that area on the scar tissue. Nothing.
I'm not in that area yet,
Okay.
but as soon as I get there, I will let you know.
Okay.
Now I'm going to pull the probe out again. I have to put more gel.
Okay.
Just applying more gel here.
So you actually place the probe in different areas then?
Correct. We go clockwise.
Okay. See, I didn't know that.
So
All
I'm
right.
gonna touch.
Mhm. Is it intense in different areas or feel
Nope,
differently?
It's just the
Just
same. Maybe more intense just where the episiotomy was.
Okay.
And here's another delivery of energy.
Feel a little bit of just the
Warmth.
like that. Yeah, just a very minor. So now you are a certified trainer on this device as well. Did I not read that?
Yes.
That's awesome. So that makes you even more experienced to come to, which is another reason I saw that and I was very excited. So that you feel a little bit warmer, but still totally fine.
Very comfortable.
Yeah, it's just like, I can't say I'm at, you know, it's not like a day at the beach or anything, you know, you're there, I'm here. But it's not anything it's not like infinite radio frequency on your face and neck, I can tell you that. Okay, that's a little bit warmer, but still fine.
So I'm getting closer to your episiotomy.
Yeah.
then.
And you said typically patients normally see or develop increased sensitivity or different things in about 30 days, and then it continues from there as your own collagen.
You will actually notice something within the next 48 hours.
Wow.
You're going to have increased lubrication
Okay.
as well. I'm still at your episiotomy.
Yeah, you definitely feel that's a different sensation, but not anything that's. It's exactly what you said it would be like.
Just a little bit more warmth then.
Yeah, that's it, really. We could play charades, we could do whatever. I mean, honestly, this is like nothing. Really is. It's like.
And you only need one treatment. You can have more than one treatment if you want to have your results.
Okay.
If you want more results,
So
or if you're needing more results.
if you're looking at that, how far apart would you then schedule them for someone who wanted more treatments?
I would probably at least give it 3 months, but probably 6 months.
Okay.
The earliest I would say 3 months, just because you want the tissues to heal and you want to stimulate your own collagen growth,
Absolutely.
and which collagen does take a while to grow.
It absolutely does. So what about on a maintenance side? Is there a
You can
maintenance?
do it yearly.
I guess yearly. Okay.
Not necessarily, you don't have to do it every year because everyone is different with their collagen loss.
Mm-hmm. Have they ever checked you that way? Your gyno hasn't? So they go in and they check to see, you know, your uterus and everything else, but then they have you squeeze down, and they can tell you if you have like beginning signs of urinary, different things like that, if the muscle is, you know, weakening in any way. So, you know, that is one of the reasons when I was talking about it, I don't have it, but if I can prevent it, why not?
Right.
So, and with a 30-minute treatment, why not? And why not talk about it? Because there's so many women out there that think about it, that are just quiet about it, or they don't think that they can really do much.
Mm-hmm.
And if you can do this, and think of how much vaginoplasty costs,
Oh, yeah.
and how much pain you're in afterwards.
Well,
So-
and even with cutting of the tissue and
I know.
vaginoplasty, you'll have numbness.
Oh,
This you do
your
not.
nerves.
Yeah.
Think of the nerve damage.
Right.
So it's completely different.
Mm-hmm.
And that's why, you know, for me it made sense. It's a great option to have out there. And people shouldn't be ashamed of it, especially women. I mean, we've had kids. We are the ones that carry, develop all that weight on that area.
Right.
So why would you not want to rebuild it?
Well, even if you haven't had kids, but running
Yes.
and doing fitness,
Anything.
a lot of women will say,
Yes.
"Oh, I have that, you know, little bit of leakage of
Mhm.
urine." So,
Yep.
I know a lot of runners that have that problem.
Really? I mean, that's what I said. I don't think that it's you know, you just have to have this. I think it could be, you know, for preventative as
Mhm.
well. And even, you know, as we age, like we were talking about earlier, you lose that collagen. We lose it in our face. We lose it everywhere. Totally easy to do. Absolutely barely minimal anything. If I had to rate this on a scale of 1 to 10, 10 being the worst, 1 being the easiest, I would give it a 0. Let's see, how about a 0.5?
For urinary continence, we do a couple more deeper in.
Okay.
So I'm stimulating up to support and give collagen to lift the bladder
Sure.
back up.
Makes sense.
Because as you age,
Mm-hmm.
or even if you had children, or not even children, the bladder tends to sit more over the urethra. And
Mhm.
so as you're running or jumping, then that's when you
Yeah.
get the urine descending down.
I don't have that. I'm preventing that.
So we're halfway done with the treatment.
Very cool. Yeah, it's totally. Still a thumbs up. This was so cute. This was just random in the back of the car. She goes, "Hey, look."
Aww.
Isn't that adorable?
Yeah. Well, you're all done with your procedure.
That's amazing. Oh my gosh,
How do
cool.
you feel?
Great, I'd high five you, but you have gloves on, so virtual.
Ding, ding.